In this video, I'm going to show you some tips to try to improve your shoulder range of motion if you're having that stiff shoulder. The first thing that we're going to do is take one of these pieces of PVC pipe. You can use a walking cane at home, a broom handle, just whatever you have that you can use for this. And you're going to sit or stand. I usually have patients sit initially, if they have balance issues, and they can just really focus on working on their range of motion. So we're going to say it's my right shoulder that's affected. And what I'm going to do is try to raise the cane up in the front as high as I can. Now I'm using my left arm to do most of the work. I am helping with the right arm. So initially it may kind of look like this, and the right arm you may notice kind of lags behind, and that's okay. So I'm just going to go up as high as I can in this position. You can actually initially start doing this movement lying on your back. You can start that way first and then progress to sitting. And so we're just going to come up like this. Another tip with this is if it's too difficult to keep your elbow out straight, you can start with bending the elbows and go up, just keeping the elbows bent up and down. That's fine too. And I have patients repeat that for maybe 2 to 3 sets of 10 to 12 repetitions. Now we're going to go out to the side of what's called abduction. So I'm going to bring the arm out to the side. I'm using my left hand to do most of the work to kind of push my arm out to the side. In the same way, the left arm is doing most of the work. The right arm is just helping a little bit. I'm going to get to that end range of motion, and I'm going to hold it there maybe a few seconds. And you can hold it for a few seconds coming up as well. I'm going to go up there, come back down, 2 to 3 sets, 10 to 12 repetitions. And we're going to work on external rotation. So my hand is coming out like this. So I've got my elbow in by my side. I'm going to start working there first, and I'm just going to kind of work my way up all the way till eventually I get my elbow up pretty high here and push back. And I'm going to complete 2 to 3 sets of 10 to 12 repetitions there. Another technique that I like to use with a cane is going to be a distraction. So I'm going to hold this out to my side here. I'm taking my left hand and I'm pushing it to the right, and you're going to feel that stretch in the shoulder joint. Initially you can start low if you want, just push into my right hand, and then you can work your way up just as high as you want to go. That does really well, especially if you're having pain. A lot of times joint distraction does give some pain relief, so that kind of pulling and tension down deep in the joint usually feels pretty good. And now we're going to go into shoulder extension. So what we're going to do is take this cane, I'm going to put it behind my back, and I'm pushing this off of my back. So I'll show you here, it looks like that. So again, I'm going to do this initially in sitting position first. I'm sitting, I'm using my left arm to kind of pull my right arm off of my back. Now patients can also take a towel, kind of throw it over your shoulder and pull it up like that, almost like you're drying off your back after you get out of the shower. That's fine too, but just for simplicity, just using the same cane works really well. And I complete 2 to 3 sets of 10 to 12 repetitions. These are going to be tabletop or mat slides, and so I like to take a towel. You can use a pillowcase, just whatever you have that's going to slide. You're going to put both hands on. We're going to say it's my right shoulder, so my right hand is going to go down first. My left hand is on top. I'm going to push this forward, and as I push it forwards, I'm kind of leaning into this. So I've got my arm all the way in this much shoulder elevation or flexion. I'm just going to kind of slide forwards and back, and I complete that for 2 to 3 sets of 10 to 12 repetitions. Now, if that's too painful, the patient has or you have a painful shoulder where you can't reach out, that really hurts, you've got a lot of joint crepitus, that kind of popping and grinding and pain in there, what you can do is take the towel or remove the towel completely, put your hands on the countertop or whatever you're using, holding on the back of a chair, and I'm just going to back up. So I'm just backing away. My hands are in a fixed position. I'm going to back away and lean in. And as I do that, I'm creating that same range of motion in my arms. Really, I don't have to move my hands. My arms are just going through the stretch here. I'm leaning back. And you would do that the same way, completing 2 to 3 sets of 10 to 12 repetitions. This technique, we're going to take a foam roller here. You can use any kind of foam roller. I like this foam roller. This one is made by Rolga. And what I'm going to do is put it on top of a table or countertop, whatever I have that's a nice and stable surface. Again, it's the right shoulder that's affected. I'm going to put this on here, and I'm going to roll forwards as far as I can, leaning in, and then I'm going to come back. And I'm going to roll forwards as far as I can, leaning in, and then I'm going to come back. Now it's very similar to the tabletop slide, exercise using a towel. I like this because there's a little more of a resistance that has to kind of happen here. And also, if you're looking for that soft tissue release or that myofascial release or whatever you want to call it, or whatever you believe the mechanism is, this works really nicely, especially going up on the back of the tricep here. It gives a really good stretch to the lat muscle in here, so that's really nice, just getting a good stretch, kind of going in there. And I'd repeat that for, again, 2 to 3 sets, 10 to 12 repetitions. With all these exercises and movements, there's no exact number of sets or reps that you need to be performing. I just picked 2 to 3 sets of 10 to 12 repetitions because that's easy to remember. I think it's just enough to get the job done without over-aggravating or over-irritating your symptoms. I do like this technique for a shoulder stretch. This is a joint distraction. We're going to use a towel, so I'm going to roll the towel up. I'm going to put it under my right arm. Remember, my right shoulder is the one that's affected. And then I'm going to grab my wrist with my left hand, and I'm pulling across my body and down. So across my body and down. You're going to feel a really nice stretch in the joint. This is creating that distraction, in the tissue, in the joint capsule. It really feels pretty good. Honestly, if you're having a lot of pain, that's a great pain modulation technique. And also a good stretch in general, to prepare for some of that overhead reaching. Our last tip, we're going to use one of these stretch out straps. I have it fastened over here to a chair, and what I'm going to do is grab a hold of both sides here, kind of lean back, and I'm really stretching my back muscles. I can feel that stretching my lats, and also again in the shoulder joints themselves, really stretching and leaning. And I would hold that for 15 to 30 seconds. Make sure that whatever you have your strap or belt or whatever you're using, whatever it's fastened to, that's a stable surface. You don't want it to come loose and for you to fall. Thank you so much for watching this video. I hope this helps improve your shoulder range of motion and the pain that you may be having.